Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Bladder cancer is one of the most common cancers in the country, and significant disparities in evaluation, management, and mortality persist in underserved patient populations. That's why ACCC launched a National Quality Improvement Initiative to explore and promote equitable care delivery for patients with bladder cancer. Here to share insights and early findings is Dr. Samuel Washington, who joins us from the University of California, San Francisco. Dr. Washington, walk us through the project.
So for each site, we implemented a standard quality improvement program structure that had 3 parts or phases. The first part was assessing the problem and preparing for the on-site visits. The second part or phase was to plan out the onset workshop, participate in that, and then start to do or implement our action plan. The third part or phase of that was to study and then act. So as we are doing now, sharing progress from each site, monitoring outcomes 6 months out from each site, and really start to digest that information to see how we can engage in continuous improvement. Now, each site had specific aims and action plans that were different. St. Jude's Medical Center was focused on tailoring patient education and treatment tools across multiple languages. University of North Carolina was focused on improving provider access across oncology and urology practices and supportive care. University of Kentucky was working on how do we engage community urologists to help understand what their needs are and improve shared care for our common bladder cancer patients.
What was your overall impression of the first phase?
Well, I think there were a few different takeaways from this first phase that were interesting and novel. One was the fact that it could be done. The feasibility of the program overall was important. The fact that we could engage leadership champions at the clinic level and then multidisciplinary team buy-in at each institution with this goal across oncology, urology practices, radiation oncology, nursing, to all come together for each of these visits to help develop an action plan is something that I have not seen much of in recent years.
How did each site's catchment area shape the specific quality improvement strategies?
It was interesting that each site varied in their role within the catchment area. Obviously, each site had their own specific catchment area, demographics, variations in patient populations. But across the sites, you saw how much of the total care was being provided by that center versus others in the area. And that was really pointing to how hospital density within their geographic region was impacting the amount of supportive care that was available or that was needed.
How did you make sure these strategies were actionable and sustainable beyond the initial 6 months?
I say that if you're not thinking about it up front, then you're not going to think about it at all. And I think when we talked about action plans, that had to be one of the key characteristics that we discussed. Which of these plans are big ideas versus small ideas? Which of these are sustainable versus not? Kind of short-term gains, long-term reach way of framing a lot of these tasks to make sure that sustainability and effectiveness are at the forefront of these plans, making sure we're not shooting too high for something that we won't be able to do versus so small it won't make an impact.
What are your hopes for next steps in this initiative?
So I think my hopes in terms of next steps for this initiative are twofold. One, to continue to monitor the outcomes, and that provides opportunities for iterative improvement for us to see how can we build and continue the momentum. The broader goal is how can we use this initiative as an example to replicate others in other clinical settings, other hospitals, other diseases as well. So this is really, we've planted this seed, it's starting to germinate. How can we let this grow into something bigger?
What are the opportunities to improve going forward?
I think the common theme across all of the sites, although their aims and projects were different, was that everyone was engaged in improving cancer care, and they all had different perspectives of what the problem may be, but came together to work on solutions. So I think the opportunity there is in having more of those discussions, bringing in the multiple levels of providers and administrators within a healthcare system. But now we have an opportunity to bring in patients and advocates. We have an opportunity to understand longer term the impact of these current projects and expand this type of work in a structured way to other cancers and other institutions, other sites in an already national program.
Thank you, Dr. Washington. You can take a look at the show notes for details on our Quality Improvement Initiative and bladder cancer resources. While you're there, hit the plus icon on your podcast player to follow this channel. Until next time, from the Cancer Buzz TV team, thank you for watching.